So first I would begin by reviewing my order. I see this patient as an order for a GI and GU assessment, so I would grab my supplies for that, which is my stethoscope, which I would clean in between each patient. And then as I go into the patient's room, I'm gonna provide privacy and then perform hand hygiene as well. Good morning, my name is Zaina. I'm a student nurse. Can you tell me your name and date of birth?
It's Ashley 41701.
Okay, is Ashley how you would like to be addressed?
Mhm.
Okay, perfect. So we do have a GI and GU assessment to do for you today. Are you comfortable with me doing that assessment for you? Okay, do you have any pain right now? Okay, any allergies? Okay, and then with your assessment, do you have any cultural or religious concerns that I should be aware of?
No.
Okay, are there any goals you would like to discuss before we begin?
Mm-mm.
All right, perfect. So if I could just have you lay down on your back with your knees flexed just a little bit. And then if you could just expose your abdominal area, I am going to begin by just inspecting. So I'm checking for any symmetry, the color, the contour, which I notice yours is flat. I'm assessing the size, any lesions, any scarring, which I don't see, which is good. I'm also not noticing any abdominal movements, which is very, very good. Can you just lift your head up like you're doing a sit-up? Okay, perfect. I don't notice any abdominal hernias. And if I did notice a distension, I would measure the girth from the umbilicus. And I also notice the umbilicus has a normal color, size, and placement, which is good. May you tell me the last time you had your bowel movement?
Yesterday.
Okay, and then how about your last menstrual cycle?
2 weeks.
2 weeks ago, okay? And then when you urinate, is there any pain with that?
No.
Okay, the color, the odor, the turbency, that's all normal?
Mhm.
Okay, perfect. So now I'm gonna go ahead and listen to your bowel sounds. They're usually loudest after a meal or about 5 to 6 hours after a meal. And I am going to be starting at the right lower quadrant and then moving up to the right upper, then doing the left upper and then the left lower. Good, so they did sound very normal. That's to hear a sound about every 5 to 15 seconds. If it was hyperactive, we would hear a sound about every 2 to 3 seconds. If it was hypoactive, we would hear less than 5 sounds in a minute. And if we didn't notice any sounds, we would want to listen for 5 minutes in order to confirm that the sounds are absent, okay? And now I'm going to go ahead and listen to some bruits. Those are just going to sound like swishing sounds. However, we don't want those. Those would not necessarily be a great sign. I'm going to listen with the bell of my stethoscope. So first I'm going to begin at the aorta, right here. Okay, and then the renal. And then the iliac. And then the femoral. Okay, good. Now, do you have a frequent history of UTIs?
No.
Okay, how about any kidney issues?
No.
No, okay, good. So I just asked because I am about to percuss, and if you did have a history of UTIs or kidney issues, I would want to use my fist or blunt percussion in the costovertebral ankle in order to assess any kidney tenderness. But since you don't have a history of those, we are not going to worry about that. So I am just going to percuss in the 4 quadrants, starting at the right upper and moving clockwise. Perfect, so we did hear that dull sound that we want. Lastly, I'm just gonna palpate your abdominal area. Is there any pain around there?
No.
No, okay, good. So if there were any pain, I would want to palpate that lastly, but since you don't have any pain, we don't need to worry about that. While I am doing this, if you have any pain though, please just let me know. And I am doing this in a round motion, checking for tenderness, also checking for any muscular resistance. And then I'm also going to assess the turgor as well. And then an advanced practitioner would want to palpate for the deeper organs and any masses. So I will not be assessing those, however, I am going to palpate the liver and the spleen. We don't want to feel those, so I'm going to palpate to make sure that I don't feel them. Okay, so I'm going to place my hand right under here, and I'm going to place my hand right here. If you could just take a deep breath in and then deeply exhale, okay? Go ahead and inhale, and then exhale. Okay, and then now I'm going to be doing the spleen. So I'm going to be placing my left hand under you, and then same thing, once I place my hand above your spleen, if you could just inhale and then deeply exhale, okay? All right, go ahead and inhale, and then exhale. All right, perfect. Okay, and then lastly, I'm going to check for rebound tenderness, just one more thing. And then with this, if you feel pain when I do this, just let me know. Was there any pain at all with that? Okay, perfect. So you are welcome to sit back up. We are all done with your assessment. Do you have any questions or concerns for me?
No.
Are you comfortable where you're at? Okay, is there any pain at all after this? Okay, perfect. And I do see you have your call light within your reach, so if there's anything that you need, please just let me know.
Thank you.